So again, welcome to the webinar. Thank you for joining us today. Couple of tips on GoToWebinar is you should have a toolbar on the right side of your screen. There's a couple things that will make enjoying this webinar a little bit easier. And you can click on the little orange button to open and close the control panel. There's a space where you can submit questions. And we'll have a few moments throughout the webinar today to answer those questions, so please feel free to submit as you have them. And we will be recording today's webinar and providing it out in an email following to everyone who attended and also who registered. And so I'll just go over our agenda for today. This is Angel Petit from Foster Club, one of the partners supporting the National Foster Youth and Alumni Policy Council. And so we will begin with just a brief overview of the council's work and providing some information on who is on the council and what the council does. Then we'll dive into the focus of our webinar, which is the survey that the council conducted earlier this year and sharing some of the key learnings that came out of that. We're also going to talk about Family First Prevention Services Act, and we're providing an overview and also highlighting some of the elements of the act that can impact reunification and the services that children, youth, and families receive. We'll have a Q&A after the end of each of these sections, and so feel free to be submitting those questions as we go throughout the presentation. And with that, I'm going to turn it over to our two main presenters, who are members of the National Foster Youth and Alumni Policy Council.
All right, my name is David Hall. I was in care in Oklahoma twice, once at 8 years old for about 6 months, and then again at 16 until I aged out.
Hi, this is Cody Boffman. I was in care in Iowa for 1 year, almost a year and a half, and then I was eventually reunified with my mom.
So can you go ahead and go to the next slide? So for the National Foster Youth and Alumni Policy Council, we are the council is a project in partnership between Foster Care Alumni of America and Foster Club with generous support from Casey Family Programs. Some of our advisory organizations include the Congressional Coalition on Adoption Institute, Foster Care to Success, Jimmy and Casey Youth Opportunities Initiative, and Foster Youth in Action. This whole group, as you can tell, has lots of support, and because of that support, we're able to bring young people from across the country to better their lived expertise and provide policy recommendations. So you all are aware, the ideas reflected in priorities in this webinar are those of the council and not necessarily the partner organizations. Go ahead and move to the next slide. For the purpose of the Policy Council, it essentially is about educating policymakers and other stakeholders by using our varied experiences in foster care. Again, creating lived expertise rather than simply having input from lived experience. Then we inform these individuals of ideas to improve child welfare policy by offering our experiences to identify and inform different priorities. And finally, we analyze the effectiveness of programs and policies based on the youth's experience while in care. Go ahead and go to the next slide. For our priority development process, and we've had quite a bit, which I'll go into later. We discussed the process of how, or I should say, one of the first steps that we have is that we convene quite recently. We've been in DC, and we convened to discuss which topics we're interested in addressing towards the goal of change in the child welfare system. And then after that, we meet over the period of about a year to discuss ways in which our lives have been affected by foster care and potential methods of improvement. We then create and distribute polls to other youth in care or alumni of care to learn more about each topic, as well as how that experience did or could have impacted their experience in child welfare. Once we have gathered all the data, we extract the information accumulated and incorporate it into a priority statement. Finally, once we have completed all changes, we submit our final draft to not only the Federal Health and Human Services Administration for Children, Youth, and Families, and federal agencies with influence on the topic, but other national organizations that are focused on the topics we have. Go ahead and go to the next slide. And for our priorities, as I said, we've had many, and they span across all of these being aging out, crossover youth, homelessness, mental health, reducing reliance on congregate care, normalcy, vulnerability, well-being, social capital, and improving policies and services in congregate care settings, as well as our newest one being prevention services. Right. Does anyone have any questions?
So David, there aren't any particular questions at this point around the structure of the council, but one participant did note it's a little bit tough to hear. So if you want to speak up just a little bit.
Okay. I will make sure that I do so.
Thank you. And I would also add that you can find copies of the priority statements on the council's website. It was on the slide previous, nationalpolicycouncil.org. You can download copies of those priorities and also learn about some of the work that council members are doing currently. And you can also follow us on Facebook. Thank you, David.
All right. So as we discussed previously, the council has developed many policy priorities. The council also works to be responsive to current policy focus areas and issues. Often, the council meets with federal stakeholders to share perspective and learn areas where we could be more information, or where we could use more information and be more helpful. In the fall of 2007, the council met with Associate Commissioner of the Child's Bureau, Jerry Milner, who is amazing. And the commissioner asked for more information from youth and alumni on their experiences with reunification and how reunification could better be supportive for children, youth, and families. So as a council, we developed a poll to distribute to youth and alumni in the early 2018 in the following discussion. I want to share what we kind of learned from that survey. Next slide. So from this survey that we did, we basically distributed it all across the United States, and we got about 106 individuals who completed the survey. And that, it included demographic questions about like age, race, ethnicity, location, and foster care experience. So like length of time, placements, and reasons for entry. As you can see, there is more females that did reply to the survey. We also have, and then like also we've seen like 4+ years, 73% that were actually in care. Next slide. We also provided a context for the national statistics around the reunification. So we want to show you guys that 51% of children reunify with their parents or primary caregiver, which is a huge proportion of the youth that are in our foster care system. As you can see, the numbers generally are consistent from year to year to year, from like 2014, 15, 16. They're pretty close knit. So we do see a lot of our kids that actually do return home. Next slide. There was a lot of awesome things that we kind of learned from this awesome survey. So one of the issues that we kind of ran into was preparing youth for when they return home. So making sure we had the right services in place when they returned home. And then second, were services needed and identified by youth were much greater than actually received. One that stuck out was mental health. And then also, third, we talked about, the high reentry of reunification for youth who completed the pool. Obviously, we recognize that there's still a lot of issues, but we have made some improvements. And one of the things that we made improvements on was asking the youth if they wanted to return home or not. 52% of our respondents from 18 to 26 were asked their opinion on returning home, while only 33% of those that were ages 27 and above responded that they were not asked. So we are at least improving in some areas of, getting opinions from the youth, figuring out where they stand with everything, but there's still a lot of work that needs to be done. Next slide. So 71% of our youth reported little to no support when returning back home, and 20 reported that they did receive some support and a lot of support. So we see there's a huge gap in whether we're really putting in the services that are needed for when children are coming back home, if we're doing enough in that area, and whether or not we're really preparing these kids to be home and staying home. A lot of the times that we see is, we put kids back home after we told them, we preached engagement and services, but once they went home, we removed those same services out of their home. So there's definitely a disconnect there. So next slide. So as I was talking, in my own experience, I wasn't really prepared to come home. My mom continued to work on herself to become this amazing mom, to really, to alleviate a lot of the concerns that DHS had, and worked on being this amazing woman. But I wasn't ready for that. That transition could have been a lot better if we would have been prepared for that. They prepared my mom to be this great mom. They didn't prepare me to be a kid. Up before that point, I was taught at a very young age to raise myself, so I took care of myself. I was handling myself. So when she came back home, she wanted to be a mom. I wasn't sure how to really react to that, because she wanted to know how I was doing in school. She wanted to make sure I was home on time. A lot of those little things that we wouldn't really consider being issues were definitely issues for me and my mom, and it took a long time for us to kind of overcome that and be able to be close again, because she wanted to be involved and I wasn't ready for her to be involved. Next slide. So kind of what we were talking about earlier is what kind of services are needed versus what services are received. A lot, 10% of the youth that responded received mental health services. 58% believe that mental health services could have supported the return home better. So the youth definitely could have recognized that mental health could have been a lot better, could have been more engaging. There's a lot of services that get missed out throughout the process, that we could, hopefully get in there, and we could prevent children from re-coming back in. So housing assistance, 45% believe that it could have helped the return home. Only 4% actually received that support. 55% believed it could have helped return home, while only 37% received for I can't remember where I was going with that. But as you can see, there's definitely some services that could have been put in a home that the youth definitely recognized that could have definitely benefited that return home. And the worst thing that we can see, or that we don't want to happen, is those kids to come back into care. All right. Next slide. We wanted a lot of feedback from the youth, so we have a few quotes actually from youth that they provided in their survey. So this was, can you describe how you felt at the time about returning home? This youth said, excited, it was what I wanted, but my mom still needed help. Our family needed counseling and we didn't get it. So again, it's that, pushing that forward of how important it is to get the right services in place, even when they return home. Our work doesn't stop then, it continues on. So, next question. Okay. Re-entry after reunification. So 65% reported that issues were going on that weren't known or addressed prior to returning home. Something that I really want to talk about is how financially beneficial it can be if we do it right the first time. We always want to do the right thing for these families, and if we do it right the first time, we can prevent re-entry, we can prevent generational cycles of families re-entering our systems, and really address those issues the first time in the home, getting those right services, even if that means extending those services that are available to the families, just to make sure that we're not seeing them back in. We're not seeing them back in for things that necessarily weren't addressed. So AFCAR's data said that 12% of kids reunify will re-enter out-of-home care within 12 months of returning home. 20% of the kids that reunify will re-enter out-of-home care at any time, not limited to 12 months. So we see that these kids are coming back in our system, which means that there was something that we missed. There was something that we didn't address with them, that we didn't address it with the family. We didn't prepare them all the way possible to make sure that reunification could actually be successful. Those that re-entered foster care after reunification, 35% reported frequent or occasional visits. Of those that didn't enter reunification, 52 reported frequent or occasional. So really, checking back in, and so we can prevent those re-entries. Next slide. Another youth, after we asked them how they felt at the time about returning home, they were unsure because the day I returned home, the same things that got me taken out of the home resumed. I was out of the home and placed into foster care less than 6 months later. I was adopted 4 years later. That was a youth from Missouri. As you can see, that the issues that we're running into is we're putting a band-aid on the issue and we're not fixing the issue. We're not really addressing what's the needs there. So we're seeing them come back in. Next question, or next slide. So this is a good time to ask any questions. I did see there was a question on here. Angel, if you want to let me know which ones those were.
Yes. So we have a couple questions asking about the percentages, and we will get those. We will share those percentages following the webinar in a handout. And you can also see this overview on the National Policy Council website. And one of the questions from an audience member, Cody, that I'd like to get your perspective on is wondering if we've asked youth what they would like to learn that would prepare them for the reunification process. And so can you talk from your perspective and what and your knowledge about what could be helpful?
Well, it's not necessarily just even in the preparation phase of asking that question. I think that question also relies on when the child's back in the home. Because I felt like I was ready to return back home, but I wasn't really sure about all the changes my mom had made. So like my mom really did a good job of, developing and becoming this great mother. Well, I didn't really get that full understanding of how much she actually changed until I was fully home. Now, something that kind of maybe could have helped with that was if our visitation would have been more liberal. So if our visitation would have, we could have had more semi-supervised. We had more time with our mom, more overnights, more stuff like that, then maybe I would have been able to ask that question beforehand. But I was placed back home, and then nobody asked me after the fact. Nobody checked in with me to see how things were going. So it kind of depends on how much that visitation's happened beforehand, and are they really? Because like in my case, I didn't necessarily know how much my mom had changed before then.
Great, thank you. David, would you add anything to that?
So, I mean, I'll reflect some of what Cody just said. I think, really taking a step back and thinking about the basics first, which is we should be informing the youth of what happened, because many times, and as we heard within the data, many times youth just aren't even told, and then they just kind of wind up back home. So that's kind of our step one. For step two, it's really looking at, like you said, those more liberal visitations. So, increased visitation, the reason why that's important is because if we have done the work on the agency side to prepare the parents or guardians, now whenever I bring that kid there, now they can see the work that's happened. From there, we would then just start needing to look at it as how are we helping to, as Commissioner Milner says, strengthen the family. So not just preparing the child to go back home or preparing the parent to take care of their child, but doing both. That might mean wraparound support. That might mean something as simple as ongoing efforts with the child to learn more. Learn more things about like healthy relationships and boundaries and things like that. But whatever that case may be, if we look at it as, that next level of how can we support the family to be a successful family and have a healthy relationship as a family, I think we'll start to see our reunification numbers improve.
Great. Thank you both. Another question from the audience is asking for citizen review board members. What questions would you suggest that citizen review board members are asking of either the agency, youth, or parents to help improve outcomes for reunification?
So I'm going to first assume, so please comment if it's incorrect, but I'm going to assume you mean the Citizen Review Board as far as the courts are concerned. So please comment if it's not, and then Angel let me know. So with how ours work, just going off of that, I think something that is always helpful to look at is think about the fact that, and this is again going to that basic level first, we don't necessarily need the court to say that you have to do this to actually provide the service and the agency pay for it. So I think that's kind of a step one is, yes, well, did the court require it? And if they did the parent follow through? Or did the child follow through? Because also that's an issue, within my own story. At the same time, though, just because the court didn't require it doesn't mean that it shouldn't be offered by the agency. And so then it becomes, well, let's look at the worker and ask, did they provide that as a recommendation if that resource is available for those services? So that's kind of, what I would look at. And then again, start looking at because we have to hold both parties accountable, right? And so, and we need to look at it as a partnership. So it starts to become, what has the agency done to provide for that family to be a stronger family? And then what has the family done to try to become a stronger family as a result of what the agency has provided? And then from there, it's, that's whenever you can start having those discussions about, well, maybe we need to look at increased visitation and things like that. But I think ultimately, if we look at and really thinking about, and maybe this is where you can kind of coordinate with the worker and have the worker simply ask the child, because this is also an issue. Do you think you are ready to go home? Do you think your family is ready to have you back? Because there's also that situation of, well, we can't do anything if services aren't available in the first place, especially in those rural areas. So if that's the case, a child might not be ready to go home, and that's just a situation where we need to look at giving those services so that can happen and they can go back home.
Thank you, David. And so the last question that I would pose is, what advice would you have for youth who identify with a cultural background and keeping them connected as they're in a process of reunification? So, for example, a Native American or Alaska Native child who is in foster care and getting ready to be reunified, do you have any suggestions for how they can also maintain cultural connections during that process? And I'll pose that to Cody first and then pass it to David if you'd like.
Just to help clarify, so are we talking about keeping the cultural ties with the family they're about to be reunified, correct?
Correct.
Okay. So, well, one, I think that kind of proposes a whole nother question to me of what are we doing to help the relationship between where the child's at to continue those cultural norms as they're going on, so we can continue those going on in the foster home, so then it's really not much of a transition for them when they do come home. So that's more of a question to me of how do we help better create a relationship between the foster parents or wherever the child's located and the family as a whole, so that we can continue those norms continuing on, so that they're getting that normalcy doesn't stop, that the whole process is less traumatic. Now, to continue, I guess, to answer the question of to make sure that those are happening, really, I mean, giving them the chance to explore different ways to be back home with their family to continue those cultural norms. I mean, giving them a chance for, like, instance, going to churches, in like Native American, going to any kind of tribal meetings or anything like that, whatever that looks like, making sure that we're giving those opportunities and we're exploring those, not just through like visitations or anything like that, allowing these kids to be able to be and where they're going to be in eventually anyway, of their natural like environment of being in church or being in meetings or whatever that looks like. continuing that moving forward.
Wonderful. Thank you, Cody. And so those are the main, I believe that those are the main questions that we had. If we didn't get to your question, we will work to provide an answer following the webinar. So I'm going to turn it over to David for the next section.
All right, so I get the really fun stuff, talking about the Family First Prevention Services Act. So we will start with an overview. The Family First Act was passed and signed into law as part of the Bipartisan Budget Act in February of this year. The act itself was created using feedback and input from many constituent groups, including foster youth and alumni, birth parents, and kinship and relative providers. It provides many improvements to child welfare, including using federal funds for services to prevent the removal of children from their families. Many of those improvements are related to reunification services, thinking more about that reentry issue. And the two key elements most related to reunification include federal dollar supports through Title 4B, and then encouraging placement in family-like homes. While we're only focusing on the provisions related to reunification services for this webinar, just because of the sheer amount of attendees, I want to make sure that we share about how it also improves older youth services, especially thinking about our populations that have the most issues with reunification are our older youth. It modernizes the CHAPI program to emphasize more successful transitions to adulthood through three main things: allowing states that have extended foster care to 21 the choice to offer services to youth who have aged out of foster care up to age 23. It provides for 5 years of eligibility for education and training vouchers until age 26, and the 5 years do not have to be consecutive. And it also allows the redistribution of unused CAFE grants to states who have applied for more funds. And for us that don't necessarily know how all that works, just to put it simply, there were times whenever we would send out federal funds, and then we didn't necessarily spend all of them, and we basically had to send it back, but then it never went anywhere. And so this is making sure that we're able to do that and, essentially spend the money that we were given. Go ahead and go on to the next slide. So how it works with reunification mainly is that, or I should say with prevention mainly, which can be used as prevention to reentry, is that states can now use federal funding through Title 4E for evidence-based prevention services. And for that evidence-based, essentially what it is you need someone to independently look at it, and you need a few years to make sure that you have groups of people that you can look at that are using those services to research it. And so with those services, they are mainly focused, or I should say, really about allowing prevention and treatment for substance abuse, mental health prevention and treatment, and skill-based parenting supports. And again, these are not something that you have to have a court say you have to have. The agency can do it on its own. With reunification supports, I should say before I get into that, those prevention services can be provided to children, or to, based on what it says, children at imminent risk of placement into foster care, pregnant or parenting youth in foster care, parents of children at imminent risk, or their kinship or relative caregiver. And again, just to reiterate, prevention services can be provided to a family in order to prevent reentry due to a potentially unstable reunification. And with that, prevention services are designed to be family-centered, including services for both the child and the parent or caregiver. And yeah. And again, that goes into that reunification. Go ahead and go into the next slide. So for that enhanced support with federal dollars, we essentially have more flexible federal dollars, and we eliminate time limits that impact the timeline that we could actually provide services, and now have increased it, or I should say now have increased it to where rather than simply kind of, starting the clock whenever a child enters care, it now starts at the time that the child is returned from care. So now whenever they're with the family. And now there's a 15-month period that starts once the child is brought back home. And at the same time, though, those funds can be used throughout the time the child is in care if it's for the purposes of helping with reunification. So this federal funding is not necessarily huge, but these changes, coupled with the opportunity for funding services and support to strengthen families and prevent unnecessary placements in the first place, could make a significant difference for families and address some of the challenges identified in the Reunification Survey and other council surveys. We'll go ahead and go on to the next slide. And for my own experience, again, I was in care twice, and I had an unsuccessful reunification because since my judge wouldn't require it, that we got mental health services based on the practice of my agency, we also did not try to give our family services. And so as a result of that, I had experienced years of trauma by the very person I was going to start living with again. And what we really need to keep in mind is that that wasn't something that would just go away in a couple months without intervention. And that came to fruition later on whenever I entered care again at 16. Go ahead and go on to the next slide. So the other part to this is encouraging placement in a family-like home. So for those of you involved in child welfare on much more in the professional side of things, this is essentially those encouraging placement in non-congregate care settings. So for youth placed in a setting other than family-like, federal dollars through Title IV-E will be limited to placements known as now qualified residential treatment programs, and those have to meet the following requirements: have a trauma-informed treatment model and a registered or licensed nursing or other licensed clinical staff on site. They have to facilitate outreach and engagement of the child's family in the child's treatment plan, provide discharge and planning and family-based aftercare supports for at least 6 months, and it must be licensed and accredited. Something quickly to note is that there are no time limits on how long a child or youth can be placed in these settings, as long as the placement continues to meet his, her, or their needs as determined in assessment. And with some of these pieces, it's important to elevate that youth voice was critical to the development of policies encouraging the placement in a family-like home. To get this to happen, youth educated Congress about their experiences in congregate care, working to improve outcomes, making sure that we continue evaluation to ensure the child's placement in a non-family setting remains the most appropriate, and they're not just sitting there because we don't have anywhere else to put them. And especially if we don't have anywhere else to put them, we should be doing something while they're there. Young people also elevated the need for non-family setting to appropriately address the needs they may have using a trauma-informed approach. And with all of these new changes, the policies can start as early as October 1st, or actually October 1st, 2019. Go on to the next slide. So with all this, I'm sure by now we've heard a lot from young people the value of support during transition to reunification and aftercare. And so it is because of this that that we just want to reiterate some of the requirements that should help with bringing children back home and making sure that their quality of life is maintained and improved while they're in care. That some of those requirements are, again, to require outreach and engagement of the child's family and the child's treatment plan of the place that they're in, and that it provides a discharge planning and family-based aftercare supports for at least 6 months. And then for our youth voice, one of the things that I think is really impactful and shows just how important this is that for our quotes, we have someone that was a former foster youth from Georgia who said, listening to me when I told them I wasn't, the question was posed, what supports could your family have used to prevent you from re-entering foster care? Well, what they said was listening to me when I told them I wasn't ready to go back home. And I think that's something that's very important that we realize, is that if we want to have truly family-based supports to provide for reunification, we have to look at, is the family ready, not just the parent and not just the child. All right, you can go ahead and go on. So what questions do we have?
Actually, before I pull some questions from members of the audience, David, I'm hoping you can just share, because there are a few exceptions to the Qualified Residential Treatment Program requirements. And I'm wondering if you could touch on those.
Yeah. So for some of that, regarding settings that are other than family-like, so federal funds for specialized services will still be available for pregnant and parenting foster youth, supervised independent living youth for youth 18 and older, and victims of sex trafficking, including those at risk of trafficking. And for those of you policy people, that at risk will not be further defined by the federal government, so it'll be remaining at what you have right now. For some of the pieces of this, youth admitted to, again, those non-family-like settings should have an assessment within 30 days. The 4E, so those federal funds, will not continue after 2 weeks unless it's determined to be the most appropriate placement. And with that, unless even with the assessment, the funding for it will still not keep going after 2 weeks if the treatment model of the program does not show that it will benefit the youth. And however, there is time allowable for states to pull some of that federal funding during the transition to a different placement. And with all this kind of, with this focus on independent monitoring, there is additional court oversight for some of these settings. So after youth has been in for, say, 60 days, the judge must actually approve or disapprove of the placement. If these continues to stay in that setting, there will be continuous judicial oversight, and the head of the child welfare agency has to be informed of that.
Great, thank you for reviewing that, David. And so there are a few questions that I'm going to share with you here. And one of those is, what are the best resources that you may know of to represent or share youth voice as states are considering Family First Prevention Services Act and their timelines for implementing?
Well, first I would have to say many states have youth advisory boards, and those young people are already clearly very invested in the work that the state is doing, and that's why they stuck around to advocate. Those young people are very well suited to do what they're doing. Cody and I didn't just start doing this; we had to develop. And youth advisory boards are one of those great ways and great tools that we have to develop lived experience into lived expertise, and being able to use their story to inform some of the changes that they think could happen through policy and process and all of those different things. With that, there's not just youth advisory boards, though. There's also many times there are alumni that are actually employed by the very agency they're working for. And that in itself is that's a truly in-house resource. And then there's also, the youth that are in care and say our more populated areas. Those are kind of geographically speaking, a very easy access point, because that's normally where our state offices are or our county offices are. And so, again, that's something where all you have to do is reach out to your workers, find out who's in care, and then, that's kind of where you go from there. Other than that, we also have many groups like, Foster Care Alumni of America and Casey Family Programs, who are very in Foster Club, who are very invested in having young people throughout the nation involved in this kind of work. And so, if, maybe that's something that you would like to see happen, that's something where I would encourage you to, after you've reached out to your allies and partners within the states, then look at it nationally and find out, who's kind of moved on that slipped through the states cracks, as far as advocacy goes, but now they're doing stuff at a national level, because then we can reach out to them to kind of to supplement that, especially knowing that they're probably knowing that they're on a national level, that they're probably a little bit more developed.
Wonderful. Thank you, David. So we have several more questions and only about 8 minutes left. So I'm going to pick a few and invite both you and Cody to be responding to what you think is what you would like to. And so one of the questions is, how can school districts support foster youth, like school districts or their support staff, provide support to foster youth when they are ready to be reunified, but the biological parent says that they're not?
So one of the things that I would say with that is that if the parent isn't ready, or I should say if the parent says that they're not ready, and I'm assuming that you mean the parent, so please comment on that if I'm wrong, but if the parent is saying that the parent themselves is not ready, then they're probably not, because we never want to encourage a presumably unsuccessful reunification, because all that's going to lead to is heartache. So the way that the school could be involved in something like that is, we have our guidance counselors and even our teachers, and many of our young people, including myself. I was very close with my band director, and he helped me through a lot of the issues that I had. We essentially had time-ins. I didn't know what they were, but that's essentially what we had. And I never got to have my reunification because of the fact that, I wasn't ready to go home. And it was a good thing that that never happened because we had a very toxic relationship, my mom and I. So, but now it's a very healthy relationship. And so I think the more that the school can focus on not having the perfect relationship, but having a healthy relationship that can be maintained and become successful, is going to help with that, as well as providing some of those resources within education, because many times, as many of us know, many of our parents are not equipped with the resources to be able to help their kid whenever they're in school. So that's something that's very practical, that we can help parents learn how to parent by also helping strengthen the relationship they have with their children.
Just to kind of go off what David was saying, I think it's very important to listen. If they're saying they're not ready, they're definitely not ready. But what do we need to do to get you there? What are some of the barriers that are affecting you? What are some of the barriers that are getting in the way for you to be ready? And sometimes maybe it's even as simple as housing or transportation or anything like that, and working with these parents to help find those resources. Obviously, we don't want to do it for the parents, but helping them in any way with providing those resources or being involved is definitely helpful, because sometimes parents, they recognize that they're not ready to be that parent yet, and even sometimes that results to a TPR, but that doesn't mean the work stops. And when I say TPR, I mean termination of parental rights. That doesn't mean the work stops, because we do know kids try to come back home even after 18, and to continue to work on themselves to be ready for when that relationship can be right, kind of like what David was talking about with himself.
Thank you both. So I'm going to share one final question, and that is, what types of visits would be helpful for children after reunification takes place?
Well, when you're saying visits, I'm assuming like, well, something that might help in some youth, and it's kind of a case by case, so it's really hard to answer the question. But some of these youth really do form a really good bond with their foster parents, and sometimes that might be able to keeping them engaged might be able to be helpful for the youth, having that additional support to the family. Also, when I'm thinking visits, I'm thinking really just having the DHS worker come out. I don't know how it is in every state, but generally, once the case is pretty much reunified, I mean, the worker comes out maybe once a month to check, but to really go in there, at least a couple times and really sit down with the family and the youth and do one-on-ones and figure out how are things going. Because the youth, like our survey was kind of showing, was that they know what's kind of going on in their home and they know what they could benefit from. And as long as we're building that rapport with the youth for them to be able to be honest with you and to be able to tell you, hey, I could benefit from this, or, I'm glad to be home, and be able to share like some of the issues that they're having without the fear of, well, then we're going to remove and go to step one and everything's going to start over. Really just working with that family to help that relationship work out.
Well, and to add, I would say kind of with this point of, foster parents, I had amazing foster parents. They even a few years ago got a governor's commendation because they've taken in literally hundreds of kids, a lot of them teens, including myself. So I think, a lot of the success that I see is whenever foster parents are talking with the biological family. Now, that's something that, you might talk with a worker ahead of time to make sure that that's something that you should be doing, right? But that's something that, again, we can create that success whenever a child is able to talk with their parents whenever they want, because we as young people, we many times we view our bio parents as our parents, and our foster parents have to have the tacked on part of foster parents, because we don't view them as our quote unquote real parents. And I know it's hard a lot of times, but that's something that we have to take into account. So how can our foster parents be there more so as resource families, and really thinking about, well, I'm here to help the family, and part of that is I'm helping to take care of the child while the parent is getting better, and I can help facilitate that relationship. And with that, I would say workers working with the parents to do family planning, along with the fact that they should be doing it with the child and the parent together. Many times I've seen in practice workers who are very well intentioned, but they're meeting with the parent separately, and then they're meeting with the child separately, and then again, they just kind of come home. This is something where we can really look at how can we make it a transition into going back home. And so let's meet together whenever we're planning out how everything's going to happen whenever we go back home, what services are available whenever we go back home, and how long am I going to have them whenever I go back home.
Great. Thank you both so much for taking the time to answer those questions and for sharing your stories and your experiences today and reflecting on the lessons that the council has also learned. I know we have several other questions in the chat box, and we will be following up with you after the webinar and working to provide answers. We are at the hour mark, so I do want to just take space and say thank you. For those of you who attended, we'll be following up with the recording, and you'll be able to share that out with colleagues and others who could benefit from this conversation. Thank you.